Kamik Recruitment, we find the perfect fit for you.
Hi and welcome to this video about OSCE exam questions in 2023. I have spoken to a few students, Irish pharmacy students that have gone through their OSCE exam in 2023 in September. And they have been kind enough to share the information, share the questions that they came across. So this is part of the pre-reg exam, which foreign pharmacists, like non-European pharmacists, have to go through the pre-reg exam in order to get registered with the PSI. So this will come in very, very useful for you guys to kind of get a whole lot of inside information and see exactly what type of questions you can expect in that particular exam and how to answer them. So let's dive right in. The first question was a Viagra consultation with no contraindications. So a Viagra consultation, like a Viagra Connect, can be gotten over the counter these days, but in Ireland you have to go, like the pharmacist has to go through a series of questions in a questionnaire, which you can actually find online. If you Google Viagra Connect form, you can download it, and you're probably familiar with it in your country as well. There are a series of questions there that can be answered by the patient with yes or no. And if you're satisfied with the questions and you're satisfied that it's safe for the particular customer to have the Viagra Connect, you can sell it over the counter. Or if some of the questions come up as contraindications and you're not happy and you're with dispensing it, you think it's not going to be safe, you can actually refer that customer or patient to the doctor, to the general practitioner. So yeah, that's the first question. You just go through a form. In this particular case, there were no contraindications, but when you will have your exam, your OSCE exam, you might actually come across some contraindications. The second question was a patient with a new hospital prescription for apixaban and atorvastatin. And this patient is already on clarithromycin, amoxicillin, Bisop, and perindopril. So you're allowed to browse the BNF, the British National Formulary, and you might know it by heart, or you might find it in the BNF that you can not. It's a major contraindication for atorvastatin to be taken with clarithromycin. And the guidelines are that the patient must stop the atorvastatin for the duration of the clarithromycin and 4 to 7 days after the clarithromycin is finished. So in this role play that you would have in the OSCE exam, you would counsel the patient and tell the patient that they need to stop the atorvastatin for the duration of the clarithromycin and several days after the clarithromycin treatment is finished. They just want to see that this is a very common major contraindication, and they want to see that you're aware of it. So that's how you treat this question. The third one was emergency hormonal contraception. And when you go through the form with that so-called patient, because it's a role play, the lady will answer that she has gotten it last month, which is okay, but you have to do further counseling on fact that she needs to be on a contraception method, and explain the benefits of contraception methods, and the dangers of sexual transmitted diseases, and everything that you need to counsel on that. But again, there were no contraindications when the lady was answering the questions. There was nothing that would have made the pharmacist say it's not safe for me to dispense this medication to you. Now, if you want more details on emergency hormonal contraception, just look it up on the Pharmacist for Ireland YouTube channel. There is a video there with like a 1-hour video going through all the questions in the emergency hormonal contraception consultation, and then you can find all the details there. You can see all the questions that you have to go through. You can see there what the contraindications are and everything else, so you can familiarize yourself with that hormonal contraception form way before you actually go to do your OSCE exam. So Pharmacist for Ireland YouTube channel, the video is called Emergency Hormonal Contraception Training or something like that. You can find it if you browse the channel. Now, the fourth question was a woman on 4 blood pressure medication. And this is about medicines management. So the 4 medicines wouldn't have any major interactions in between them, but you have to counsel which one to be taken in the morning. If it's a water tablet, you have to counsel to be taken in the morning or at noon at best, not at nighttime, because you'll need to go to the bathroom all night if you take a water tablet at nighttime. And just do your pharmacist job basically, and counsel this lady on how to take the 4 blood pressure medications. She might ask you, why does she need 4 blood pressure medications? Why is she not just on 1 or 2? Or there can be a series of questions, and you can answer them based on your pharmacist skills. Now, number 5. The technician does a script, an extemp script, in a wrong manner, in a sense that there are labels missing, there are wrong items being used, like instead of putting the right ingredients in the extemp, the technician actually chose the wrong thing to add in there, and you have to tell the technician to discard of all that they have done and just start from scratch, and explain to the technician which ingredients go in which order, and how that needs to be done. It won't be anything complicated. It will be most likely a cream with a powder, or 2 creams or 3 creams being mixed together, or something like that, or crushed tablets, but it won't be anything too fancy for you to handle. You just have to notice where the technician went wrong, and actually go in and explain to the technician how to do it right. There's a video on the Pharmacist for Ireland YouTube channel as well. If you look it up with extemp prescriptions, it will give you loads of resources on extemp prescriptions and examples, and basically everything you need to know about extemp prescriptions in Ireland as well. Number 6, a doctor is calling about a patient with rheumatoid arthritis. Now, there's nothing fancy here. Basically, you just need to be aware of the possible side effects of the medication Humira or whatever they want to go with for rheumatoid arthritis. Um, you can look it up in the BNF. You're actually allowed to do that. And when the doctor or the actor that pretends to be a doctor rings and asks you about it, you can counsel the doctor, um, and not cancel the doctor, but you can conversate with him and exchange information back and forth and make sure that the medication that the doctor wants to prescribe is actually safe for that particular patient. So yeah, you just got to be familiar with contraindications and um, possible side effects. So you, as the pharmacist, would have all the medical history, medical records of what medication that customer is taking, and you can exchange that information with the doctor, and you both of you can make sure that the medication the doctor wants to prescribe is safe for the customer to use. Now, the number 7 is a patient on a rake of pain meds that wants CBD oil over the counter and information about it. And he will ask you, will it make him high? And you have to explain it to him that it doesn't have the potential to make him high, because the ingredient that actually does that has been removed from it. So there's no potential of actually getting high, or and he will ask you if he can get it covered on any scheme, as in if part of that CBD oil could be paid by the government, part of it or the full amount. And you have to explain it's only available over the counter at full price. It will not be covered on any scheme. So they they can only buy it at the price that the pharmacy sells it over the counter. Whereas if it was available on any scheme, then part of the price or even the total price of the medication would have been paid by the government, and the patient would have gotten it for free or would have gotten it at a considerably lower price. But in this case, it's only available over the counter, so not covered on any schemes. Number 8. Station on regulations and legislation on EU doctors prescribing in Ireland. So the particular question, I believe, was a French doctor that was in Ireland and wanted to. So he prescribed for a good number of years. He was registered here with the government body that regulates, the doctors, and he wants to go back to France and is wondering, can he still prescribe um, medication for his Irish patients if he's in France? And yeah, you got to look up that whole regulation and legislation with doctors. But if he wants to do it on a constant basis, I believe the answer would be no. He cannot. The prescriptions in the EU are valid in Ireland, but they're only to be taken if you're passing through as a if you're in any schemes. If you want to get it under the EU scheme or um, any other scheme, you have to just be passing by and then it's valid. But if you're constantly getting it from a doctor from the EU, you wouldn't be able to pick it up here. So if he's a private doctor and he has private patients, so everything that he'll be prescribing, the patients will buy on like a full price in the private mode, uh, then his prescriptions would be valid. But if he plans to prescribe on any schemes, for patients that would be covered on different schemes, then that wouldn't be feasible. So, and especially for CD, for controlled drugs prescriptions are only valid if they were written by a doctor that practices in Ireland. But yeah, that would be the major guideline, and you'd have to advise him anyway to um, pick it up with his regulatory body of government and ask them for an official answer anyway. A man hesitant to start nicotine replacement therapy. So you will be guiding or counseling a man that is smoking, but is hesitant to start patches like nicotine patches or nicotine inhaler or nicotine gum, any sort of nicotine replacement therapy. Um, so you would have to jump in and explain the benefits, explain that the nicotine replacement therapy will give him double the chance of actually quitting, and just counsel on the overall effects and overall benefits of the therapy. Number 10, out of date drugs. Procedure to dispose of out of date controlled drugs. On this one, we have another video on the Pharmacist for Ireland YouTube channel on how to dispose of out of date controlled drugs. Basically, you are only allowed to destroy them in the presence of a Gardaí, which is a policeman, or a PSI inspector. And in your controlled drug register, at the back of the book, you have a special section where you write in the name, the date, the name of the medication being destroyed, and the quantity. And you, the pharmacist, sign, and the Garda or the PSI inspector signs as well. And then in the presence of the Gardaí or the PSI inspector, you take all those medications out of the blister packs or packaging or whatever. You dump them into a jar that contains a special kind of silicone, and when you fill that up with water and you give it a shake, it will render the tablets useless. They won't be able to be used again. So that's the destruction of it. And then you obviously dispose of it in a legal manner with the company that collects the rest of your out of date drugs. And if they are controlled drugs that have been brought back by the customer, you don't actually. So if someone dies or is told to no longer use those medications or no longer needs them for whatever reason and brings them back to the pharmacy, you as the pharmacist can destroy them in the presence of the pharmacy manager, or if you have a support pharmacist, both pharmacists can sign up on them and destroy them in the same manner. But you don't actually need the Garda or the PSI inspector. So that covers that. You can see more details in the video on the YouTube channel. Now, number 11 is a bit harsh. So you have a situation where you or another pharmacist in your pharmacy has given a wrong antibiotic to a child. So you have to ring the mother and explain it. So in Ireland, they encourage a total transparency policy. So don't hide anything when you make a mistake. You will most likely not be punished, or action will not be taken against you if you are transparent and very open about your mistake. So when you ring this mother, you need to explain that, and use a proper tone and use proper words, and explain that a mistake has occurred, and that her child has received the wrong antibiotic. You have to ask about the state of the child, and then counsel on what is, you know, what what can be done to rectify that mistake, and they have to obviously come back and get the right medication. You also have to ring the doctor that has prescribed that antibiotic and tell the doctor about the mistake, and you and the doctor will both decide on what is best, just going forward. Is it just to go on the first antibiotic that was prescribed, or which course of action needs to be taken? But total transparency has to be shown. Okay. um, so they want to see how you manage conflict. The lady acting as the mom might put you under pressure. What do you mean my child got the wrong thing? And might cause you to be under pressure, and they want to see how you do it, how you actually deal with a under pressure situation. So you need to hold your nerves. You need to use the proper tone and the proper words, and pull through. Okay, and let's see. Number 12 is how to use glucagon. Now, glucagon is an emergency injection in case a diabetic patient has blood sugar that's too low and causes him to be non-responsive. And basically, they are used in the same way as an adrenaline pen. So you inject them in the side of the leg, but you don't do that unless you have proper training. So the IPU has a course on it. And once you get through that course and basically you're certified, then you as a pharmacist can actually administer glucagon in an emergency situation. But in this case, the question was how to use glucagon, as in instruct the patient how to use it. But again, you need to have the course done if you want to be able to instruct the patient on how to use it, or the relative of the patient on how to use it in a proper manner. So once you register as a pharmacist in Ireland, you can actually go through the IPU course. But in your home country, or even online, you can find resources. In the summary of product characteristics, you can find them. There are probably videos on YouTube about it, and you can document yourself in the proper manner of injecting a glucagon injection. So these have been the 12 questions that have occurred in the pre-reg exam on the OSCE exam in 2023. So in 2024, there will be very likely similar questions. These cover what most of the material that they expect you to know. If I will be able to obtain further information on how to better prepare for your OSCE exam, for your pre-reg exam, I will email it on to you, because you have entered your email when you decided to watch this video. So keep an eye on the emails. Further information will be coming to your inbox, all in order to just get you as prepared as possible for becoming a pharmacist in Ireland. Okay, I will see you soon.